In this next video, I'm going to talk about 3 common sleep disorders that can happen after a concussion or a brain injury. One of them is insomnia, and this is when you go to sleep and you're unable to fall asleep within 20 to 30 minutes. The second one is fragmented sleep, and this is when you're able to fall asleep, but then you wake up and you're unable to go back to sleep. You may stay up 2 or 3 hours, or you're not able to go back to sleep at all. And with people who are 40 years or older, it's a normal sleep pattern to fall asleep, wake up, and either check on the kids or go to the restroom, and then be able to fall back to sleep within 20 to 30 minutes. So if you're having that just brief interruption sleep, that's a normal sleep pattern. Fragmented sleep, like I said before, is when it exceeds that 30 minutes going into 2 to 3 hours, and then some people don't even go back to sleep for the rest of the night. And you unfortunately can have both of these: difficulty falling asleep. Then once you fall asleep, then your sleep is disrupted by a significant amount of time. The third common sleep disorder that can happen after a brain injury is sleep apnea, and researchers have found that sleep apnea is higher in traumatic brain injury survivors when compared to the general population. Symptoms of sleep apnea, because I wanted to say that a lot of people aren't aware that they have it, and they think that they sleep just fine. But if you're having these symptoms, you may want to consider getting screened for sleep apnea, and that is daytime sleepiness, fatigue, falling asleep while sitting, watching television or a movie. That is not normal. Most of us don't do that, so that's a symptom to monitor. Having difficulty with attention or memory, or any higher cognitive executive functions such as word finding, and then difficulty controlling seizures. Untreated sleep apnea can increase your risk of heart attack, stroke, cancer, and dementia. If you think that you may need to be screened for sleep apnea, just notify your general practitioner, and they can send you a referral to have the test done. And it's really easy test to do. They usually give you equipment that you take home, and